Welcome to Med-Surg Tutor, and in this video, we'll be discussing post-op nursing care. Stick through until the end because I have a few practice questions to go over with you guys. So let's jump right into it by talking about initial post-op assessment. This is when your patient is finally done with their surgery and then they go to the PACU or the recovery room. So when they come back, first thing you want to jump into regarding assessment is airway, breathing, and circulation. Is their airway open? Are they using accessory muscles to breathe? Is the pulse strong and steady? These are some things you want to assess because this is very important. Next, you want to check their level of consciousness. Are they awake, alert, and oriented? Can they follow basic commands? This kind of tells the nurse how they're coming out of the anesthesia. Now, moving on to the vital cycle. It really just depends on your orders, but expect to get those vitals. And finally, you want to also assess those pain levels and the surgical site for bleeding or drainage, and whether or not they're urinating. If they haven't voided within 6 to 8 hours or their output is less than 30 milliliters an hour, you may need to scan the bladder or notify the provider. Let's discuss some of the common post op complications. The first one is a major one, hemorrhaging. This is when your patient is bleeding out uncontrollably. Some of the signs you want to look for are hypotension, tachycardia, a drop in the hemoglobin or hematocrit, or saturated dressings. As we can see, on our patient on the screen, he has a saturated dressing where he's bleeding uncontrollably. This is a sign of what hemorrhaging will look like. Next is infection. This includes the surgical site infections, which may not show up until the second or third day, but you want to watch for those symptoms like fever, redness, purulent drainage, or foul odor. These can indicate signs of an infection. You want to jump on top of it before it gets worse. Next is a DVT or pulmonary embolism. So here you want to assess for unilateral leg swelling or pain and watch for chest pain or sudden shortness of breath. So with a DVT, a lot of these patients, after they come out of their surgery, they're put on bed rest, meaning they're not really moving as much, which increases the likelihood of a blood clot forming. And usually, some providers will prescribe something like an anticoagulant to help, but you want to be on top of it as a nurse and prevent. Next is pneumonia. If your patient isn't coughing, breathing deeply, or mobilizing, fluid can settle in their lungs. So be mindful. And then finally, that urinary retention I was telling you guys about earlier is common after anesthesia, especially with opioids. So let's talk about a few of the nursing interventions that help prevent complications. First, we have the incentive spirometer. This you'll have your patient use 10 while they're awake. It helps open up their lungs, turn, cough, deep breathe. This should be done every 1 to 2 hours. Early ambulation, even getting out of the bed to sit in a chair, walking if your patient is able to, if it's indicated for them. This promotes circulation and stimulates those bowels to get moving. And then legs exercise or SCDs. These prevent the blood clots I was telling you guys about by keeping the legs moving or compressed. And obviously, you want to monitor those surgical dressing and drains by checking for the amount, type, color of the drainage, mark the drainage spots on the dressing if needed. Basically, just documenting everything that's going on with the wound or the drains that the patient has going on, and being sure to identify what's abnormal and normal when it comes to those drains and wounds. Finally, we want to talk about pain management. Pain is one of the biggest concerns post op. So you want to assess the pain using a 0 to 10 scale and then reassess every 30 to 60 minutes after you give the medication that's prescribed. IV meds obviously kick in faster, but they wear off quicker than PO meds, which is meds taken by mouth. Encourage non pharmacologic techniques to your patient as well, such as their positioning, blankets, music. We just want to make the patients comfortable, see if we can distract them from the pain, things like that. Alrighty, guys, we went over some of the concepts for post op nursing care. Now I have a few practice questions I want to go over with you guys. Question one: a nurse is caring for a post op patient who suddenly becomes restless and anxious. Oxygen, oxygen saturation is 88%, and the patient is short of breath. What is the nurse's priority action? A. Administer IV pain medication. B. Raise the head of the bed and apply oxygen. C. Check the surgical dressing for bleeding. Or D. Call the healthcare provider immediately. The correct answer here is going to be B. The priority is always going to be airway and oxygenation. And look at that question. It says the O2 is 88%, which is pretty low. We don't want it that low. Raising the head of the bed and giving oxygen addresses impaired gas exchange, which is what this patient is going through. And pain meds or calling the provider don't fix the problem of hypoxia. Bleeding might be a concern. So C could have been a possibility, but it's not the priority. The ABCs come first. Question two. The nurse notes 100 milliliters of bright red drainage in the surgical drain 1 hour after the patient returns from surgery. What is the best action? A. Mark it on the dressing and continue to monitor. B. Notify the surgeon immediately. C. Reinforce the dressing and recheck in 2 hours. Or D. Document as a normal post op finding. And guys, the correct answer here is going to be B. Notify the surgeon immediately. So, bright red draining that's greater than 50 milliliters per hour shortly after surgery, because this patient is 1 hour after surgery, could mean there's active bleeding going on, right? This is not normal and requires immediate provider notification. So pay attention to the question and the information it's giving you, right? So 1 hour after the surgery and we have 100 milliliters of bright red drainage, that is way too much and that's a concern, which goes back to that hemorrhaging I told you guys about. That's a big concern and we want to let the surgeon know about that. Question three. A nurse is assessing a post op patient's incision and notes redness, warmth, and swelling around the wound on day two. Which interpretation is most accurate? A. This is a normal inflammatory response. B. This is a sign of infection and requires intervention. C. This indicates poor wound perfusion. Or D. This means the patient is allergic to the suture material. And guys, the correct answer here is A. Mild redness, warmth, and swelling are normal signs of inflammation, especially during the healing phase. Infection signs usually occur on day three or later, and these include purulent drainage, fever, and increasing pain. So you might have thought that this patient was at risk for developing infection, but remember, this is only day two and they just gone through surgery, so some of these are, well, these are normal findings when your patient just came from surgery. And the final question I have for you guys: a post-op patient receiving opiates reports nausea and dizziness when attempting to ambulate. What should the nurse do first? A. Call the provider for an antiemetic prescription. B. Have the patient sit and dangle their feet before standing. C. Encourage the patient to ambulate to prevent DVT. Or D. Hold the opioids for the next dose. And the correct answer here is B. Have the patient sit and dangle their legs before standing. So here you kind of need to know how opioids will affect your patient. So with opioids, everything is low and slow. So they might develop that orthostatic hypotension. And the way you would come about that is just having them sit on the edge of the bed and dangle their feet for a bit before they get up. All right, guys, that is all I have for you today. Happy studying.